All right, you all. So welcome back. I am super excited to have Miss D here with us, you all. And look, we're talking about menopause. We're talking about women's health. So who am I? I'm your host, Carlika Katrina Basnight-Menendez. Yes, all of that. And I am the number one Black face of women in menopause. And you may say, what? She's not the only one talking about it. I'm not. And I'm so glad that I'm not, because when I was thrown into menopause, I didn't have any support. I didn't have any guidance. I didn't have any communities. I was out here on a limb trying to figure things out all by myself with Google. I really wasn't big on YouTube during that time, but then I just started researching, like, what's going on? What's happening? I'm hot. I'm cold. I'm this. I'm that. I have vaginal dryness. I have it. So look, this is why we're having these conversations, to bring more awareness. Look, ladies, I know COVID has done a lot. And it's still here, but I just want to encourage you all, whatever you get from this broadcasting, is go get checked out, right? Whatever you do, go and get checked out. All those annuals that you missed in 2020, 2021, and all of those things, this is the year to get back on track. And so things that we can do, none of this, always consult your medical providers for any information. Everything that we're saying here is either it is expertise, but it is from our own experiences. And once again, because menopause and everything else in the world is not a one size fits all. So check with your providers, your GYNs, your general practitioners, your therapists, all of the people, right? We need all of them, and just for your own health. And so Ms. D. Hartmann, thank you so much. I appreciate your yes and welcome.
Thank you. It's delightful to be here. Thank you so much. And again, for all you're doing, there's so much. This is so needed in the world. There's so much we don't know, truly so much we don't know, but also so much we're not told. And learning this way and any way that we can, helping each other, yes, building community and being able to talk is huge. It's huge. So thank you. Thank you. Thank you. I'm a registered physical therapist. I spent almost 30 years with a private practice in the Chicago metro area, specializing in the treatment of abdominal and pelvic pain and dysfunction, with a specialty focus on treating women with chronic vulvar pain and the sexual dysfunction that came along with it. It was a tremendous honor for me to be in that space and to have women entrust their most intimate selves with me and bring that to me. I closed that practice about 4.5 years ago, and although I was always doing a lot of things other than my practice that I was very passionate about, I'm not practicing anymore, but all of the things I was passionate about, I'm now working way more than I ever worked when I was in the clinic, and it's just, I love it.
Oh, that is amazing. I just want to say one thing. Your presence makes it very warm. I love how you said it, that women entrusted you. And I think sometimes people, when we're in certain professions, it's like, if you delivered one baby, you've delivered them all. If you've done autopsies, you've done them all. If you've seen one vagina, if you've seen a bunch of vaginas, it's just like, but when you really just look at the person, even in the work that I do, and we deal with specimens, so I don't deal with the direct patient, but a patient is a patient's
whole person
biopsy. That is a patient's information. And when we look at, I think that is just so powerful right there, where you said they entrusted me for that time in private practice with their most sacred parts, because I think a lot of women, what we've been told or how things have been presented to us, it's almost like we feel uncomfortable. It's already uncomfortable going to get your pap smear, going to get some type of testing and different things. So it's already uncomfortable. But those words right there, I would have loved to come to your office and be like, okay, I feel like she's connecting, and she made me feel like, this is okay. Let's have the discussion, right? Because who wants to have the discussions of sexual dysfunction or any of those things? No, and most of us don't even, we
really don't want to talk about our vulvas. What, do you want me to talk about that? No, no, right? No, thank you.
Right,
and let me be clear. Anytime I ever talk, and I do a lot of speaking to physicians groups and to psychologists as well as physical therapists, we really, as PTs, had the greatest gift because we got to spend an hour with our patients every week.
Wow.
So that the connections that we were able to make were invaluable, to say the least. So
And I can definitely understand that, because nowadays everyone's always like this. And so when you go to your doctors, I mean, you might get about 15 minutes, and that might be pushing it, just with all the patients they're trying to see. And then now we're in this more of a telehealth and virtual health and different things. So it's a lot, but to find someone that makes it warm, to have the conversation, makes it warm to say, look, we're going to get through this, and these are some steps. And so you're right. A lot of women, heck, some women might not even know what the vulva is. So just go into that a little bit with the description, because
very good.
I'm just saying.
Well, then we don't say the word vulva, right? We usually say vagina. We're okay with vagina. And then I'm not exactly sure how that all happened, how it transpired in our world. But we talk about the vagina, but the vagina is on the inside.
Right.
What I'm making reference to is purely the vulva, which are the lips, the clitoris, the labia majora, the labia minora, and the clitoris in all of the area between there, literally between the pubic bone up high and the anus down below. Yeah. That's all considered the vulva, this very wonderful little clump of the human anatomy.
Yes.
Everybody is different.
Right.
And every vulva is okay. As a matter of fact, they're all different colors, they're all different shapes. Right to left, they're different. They're just like hands, ears, eyes. They're all beautiful, and they all change with age.
Yeah.
They're small, and we go through menarche, and they get full. And as we go through pregnancy, they enlarge and they get little, and they enlarge and get little, and then they stay nice and healthy. Then through the rest of our lives, and then we hit menopause, and they do go back. Menopause is a very important part of life that you talk about. We all go there. I mean, to not go through menopause is not a good thing, because that means something else has happened.
Right.
It's just very different. And in our society, whomever, well, once you hit menopause, you don't have hormones anymore. You can't have babies anymore. Other mammals, by the way, when they are unable to bear children, die.
Right.
We as humans don't. We stay alive. And I'm here to tell you that we can still stay, through what our society tells us, we can still stay vibrant. We can still stay alive. We can still stay sexual. We can be so full of energy and so full of life, but we have to find it. It's a little bit harder to find. It's a little bit harder to get to.
Yes.
But it's there.
And I love that, because menopause, it's another stage. It's just another transition in our life. But I have had so many conversations with women, even before I was menopausal. So I didn't have like conversations, but I would hear women say, oh my gosh, I don't have sex anymore. I have no sexual desire. It's painful. It's all of these things. So when I had my full hysterectomy at the age of 30, women were just like, oh my God, you're going to be dry as the Sahara Desert. You're not going to want to be touched. You're not going to. I was so distraught that I was just like, oh my God, is that the way they're living? And have you just made yourself believe and talk yourself out of pleasure and different things, or even the things that you just enjoy? And I was like, no, I'm not going to, I refuse to live my life like that. And I was just like, okay, I was thrown into menopause. Like I said, no support, a bunch of pamphlets now. I had a lot of pamphlets.
Well, and they really don't. And those, now in hindsight, do you think those pamphlets told you what you really needed to know?
Not at all. It gave some basic bullet points of what menopause is and what you can expect. And I put it in air quotes, because once again, menopause is definitely not a one size fits all. Everyone does not have the same symptoms. And a lot of times I think we focus on the symptoms than rather all of the aspects of it, where even if you're not menopausal, your pelvic floor, your vulva, all of these things, it's a part of our health.
Right. And to be clear, and this is one of those kind of those balances. The Western medical model, in looking at all of this, has their way. And I always had to step back when my patients would come in and they were dissing physicians because they didn't do this and they didn't do that. In from what I do, which is very different, a really weird skill set, knowledge set. Why don't they do this? Why don't they do that? Why didn't they treat me this way? It's like, because they treat with the methods that they learn. And that's wonderful and that's fine. And we really need that. What we also need is what you just talked about. We need to know that there's a whole world, and functional medicine is coming into that much more. That there's so much to life and living outside of that medical model, and so many more things that we can do outside of those bullet points.
Yes. And that is so powerful, because when I think of it in hindsight, I'm like, yeah, I remember looking at some of those pamphlets and going back to the pamphlets when certain things at different points of time started happening, and I still didn't have any answers. I was just like, I remember my first hot flash, and I was looking around the room like, oh my God, what is going on? I just want to jump in the freezer like butt naked. What is happening? So I was just, when I had my first experience with some dryness, I said, oh my God,
hang on a second. Yeah.
And I cried. I cried because I was just like, oh my God, what? I don't want to live my life like this. And this is what they talked about. But then I was like, I won't let this defeat. And so a lot of women, they're just like, I don't want to get to menopause. And I'm like, want to or not to, you're going to get there. Now, how severe your symptoms are, what symptoms you experience, your journey may be different from the next woman. But even a lot of times we haven't been taught about our vaginal health or vulval health, our private part. We've been taught, make sure it's fresh, make sure it's these things. But what if you do have pain, right?
Right. Well, remember sex education, if you had any. You remember what they told the boys? They talked about wet dreams. They talked about morning erections. They talked about masturbation.
Yep.
Right? What do they talk to us girls about? Don't get an STD.
Don't get pregnant.
Oh, don't get pregnant and wait till you have your period. It is, you're going to just bleed, and it happens every month. So from the get-go, again, this is history. This is just what we're taught. Yeah. Women aren't taught about their bodies from an anatomical perspective. And I can tell you, I've been in this business for a very long time, and I am just now, I'm actually doing a talk, actually 2 talks later in the year. And one of the sections is labeled Sex 102 : Anatomy.
That's good.
Because we don't know, and we don't talk about it. But I have to go back just 1 second to the menopausal things. Nobody really knows, or nobody really talks about beforehand how much we're going to miss estrogen.
Mm-hmm. Not at all.
Because, it just happens, and that's the way it goes. Well, yeah, but give us some hints here. And what you just alluded to is what happens. I mean, we lose our, we kind of become emotional and labile. We get kind of flatter. Mm-hmm. We have vaginal dryness. We have a tendency to wet our pants. The fat cells in our butt migrate to our gut, and all of a sudden we have a fat belly. It's like, where did that come from?
Where did that come from? The area on your nipples, everything's expanding, and different things are happening. You look at it here and you're like, oh, okay, well, where did that get on? But
who planned this? That's what I want to know.
Say, going back to the anatomy, and I do believe that if we were taught more about the anatomy at a younger age, then we will have more of appreciation and not so much shame, even when we go through these transitions of whether it's gaining weight, whether it's a small butt or a bigger butt, or all of these different things. I feel like we, and even midlife women or women who are older and different things, people wouldn't want to always have sex or something in the dark. I think if we just had that greater appreciation and perspective of, we wouldn't be embarrassed to say sex or certain words such as menopause, such as penis, such as this. We wouldn't.
We don't have a problem saying penis.
We have a problem.
Everybody can say penis. Find the same people and ask them to say clitoris,
and they're like, huh? Ugh.
Now, the two, everybody always says the clitoris is the female penis, and there's a lot of differences between the two. Trust me. The first and foremost. Now, let's be clear. First and foremost is that men hold their penises, touch it, feel it, pull it out of their pants, hold on to it, and put it back in their pants. How many times a day? Every time they empty their bladder.
Right.
They're very aware of that tactile sensation. They kind of know what it feels like, and
Yep.
we don't use our clitoris for anything except pleasure, and then we don't do a very good job of it.
Right.
So this is my new push in my world right now. Is really I
love it.
Am I able to bring this up?
You are. Yes.
This is the book that your thing is goes the other way. That my co-author and I just wrote, Elizabeth Wood. And it's all about this stuff. She's we met years ago, and she was a sex therapist at the time, but she's given that up now for the medical model. And she does all sorts of hands-on work. And she would see clients and get rid of their pain from the pleasure perspective. And all those years after we met, did it through a physical therapy perspective, getting rid of the pain and then leading to the pleasure. So this book joins those two things.
That's amazing.
And it talks about anatomy. It talks about varieties of anatomy. It talks about sensuality. If we could just learn how to build and really, really take full agency of our sensuality, then our sexuality would come much more easily.
Yeah.
But we all need to really, and I just was at my own PT meeting. Now, let's be clear, I was at a 2-hour presentation. Women who've been raised in religious households and what they were taught about sex.
Nothing. I was raised in a religious household. Nothing. Through the church, and I'm not bashing the church. You all don't.
No.
But from my own experience, Dee, I can honestly say nothing. It was don't have sex, wait till you're married, don't have sex. And even once you got older, where you were dating, that even with their singles ministries and all of these different things that were there, okay, when do we stop playing games in different things and actually teach people how to love themselves, love their body, and that feeling sexy and all of these things, or being sexy, it really, to me, it's up here. So look, go ahead. I
totally hear you. And I agree with you. I don't have any negativity. I don't have any whatever. There was a study done by 2 Canadians, 20,000 women who took this study, who did this 150 item questionnaire. And what came out of it are just mind boggling. However, my point for bringing that up, this whole 2-hour talk, no one said the word clitoris. Okay. But whatever. But my point is that I want to reach out to these authors because I want to use this same questionnaire in women who have chronic vulvar pain and in a across the board group of women, because I think even those who aren't raised in religious homes have a lot of the same kinds of culture imposed and across cultures. I mean, different cultures have different ideas and different ideologies. And again, that's perfectly okay. I totally understand the cultural piece. But at some point, what you're saying is so true. When do we really get to learn about the beauty and the power that our sexuality has? I mean, that's what's so important to our being. We're female.
It is so, and I love that, important to our being, important to our well-being and our mental. It's in every aspect of us. And once again, I go back to, if we were taught more about your sensuality, where people get it confused, sexuality and sensuality, they cross those. And I'm just like, no. To me, if I can love every part of me, even when I was this weight versus this weight, whether I look this way, have abs, no abs, all of these things, when the changes, gravity and all of these things, I'm not going to pay attention so much to those things, because I'm going to say, I love this role that I have. And yes, I'm going to do what I need to do if it's going to pose a medical issue for me.
Right.
But overall, I'm not going to let society and those things around me dictate how sexy I feel as a menopausal woman or a non-menopausal woman.
Throughout the life cycle. Right. Throughout the
You.
life cycle, from preteen through geriatric.
Yeah.
And we have the issue there was another talk on eating disorders in the elderly.
Wow.
Say eating disorders in the elderly. Holy cow.
Wow. And I used to have an eating disorder.
Pardon me?
I said I used to have an eating disorder. I started in the 10th grade, anorexic, all the way through, college, my late 20s. Like, I couldn't get skinny enough. At 80 pounds, I still thought I was fat. Yeah, so it's still one of those topics that people, we don't really talk about. You touch on it a little bit, or there's not enough. I know in some communities, there's just not enough support and different things with it. And so with that, this is why we're doing this, more awareness. So let me ask you this, Dee. How does a woman even know? Because sometimes we have pain, but a lot of times we push it back to the back of our head, like, oh, I'm just not going to pay attention to it. So what are some of those signs or symptoms of that vulvar pain that people really should say, look, I need to pay attention to this or go see someone?
First and foremost, when you touch your vulva, when you try to insert a tampon, when you try to put a finger in, when you try to use a sex toy, when you try to have penetrative sex, when you go to the doctor, when you go for a pelvic exam, if you put on tight jeans and it's not comfortable to sit, if you can't sit on a bicycle because it hurts your vulva is a wonderfully delicate and wonderful place, but it shouldn't hurt.
Wow.
Ever. It really shouldn't hurt. Now, you have all sorts of pain problems. You have endometriosis. You have, when you have any kind of bladder and bowel disorders, that can have an impact on the vulva too. But it should never hurt. When it comes to sex, sex has a very broad range of how we do it, when we do it, right? And everybody knows what a quickie is like. Okay, everybody knows what a quickie is like. And quickies aren't always the most comfortable.
Right.
Okay. So you say, okay, well, that's just, we don't want it to be painful.
Right.
And we don't want it to be something that bothers you after the fact. Lube and more lube. Olive oil is my fave. Stains the sheets, but it's still the best and it's totally natural. Coconut oil is great too. Right. But none of it should ever hurt. And we know that regardless of size of the vagina versus size of whatever it is that you're trying to put in there, that the vaginal tissue, when normal, the opening, the introitus, that area at the opening, when fully aroused with good blood flow, with a decreased parasympathetic system, with not a lot of tension in and around the area, should be able to expand and accommodate. There are times that women may have a narrower vaginal canal or a shorter vaginal canal that we have some issues with, but remember, that's where the baby's head comes through. I've yet to see a penis the size of a baby's head, but there may be some out there. Maybe I'm just, it's just my very limited experience.
Look, I don't think I want that one.
We don't want to go there. We don't want to go there, right? But it's very expandable, but it has to be, when it comes to sex and intimacy, it needs to be aroused. And that may take up to 40 minutes. I mean, we know from the literature that men become aroused and able to go through the cycle from Masters and Johnson straight up the line there, this slam bam, thank you, ma'am. I really don't ever like doing that, but they can.
Right.
They can. And women, I'll suggest to you, can do that by themselves with self-pleasure, with a vibrator.
Right.
Oftentimes we can, do those and have an orgasm 3 to 5 minutes. You say, okay, well, I've done that. But we don't have a tendency to function that way or do that with partners.
Right.
So pain should never be there. If it is there are things that can be done about it. There's a lot of stuff in the book that could help that. Women's health physical therapists can help that if it's a chronic problem. Anything that's chronic is over 3 months. We know that 3 in 4 women have pain with sex at some point in their lives. It's incredibly prevalent. And as many as 16 to 20% of women have chronic vulvar pain.
Wow.
That's not normal. And we think that number is very, very, very low.
Right.
So you're going to go to your doctor. Doctor's going to say, I need to do a vaginal exam. If you have pain, say, I need a pediatric speculum, period. And if you don't have a pediatric speculum, I don't want you to do it because I don't want to go out of here in pain. And if the pediatric speculum hurts, please ask them to stop because it's your body. I got off on that. I forgot where I was going with my list, but I had my fingers up. I was going to give you a list. Doctors shouldn't hurt. What was I going to say? If you do, or your doctor says, oh, it must all be in your head, you need a psychiatrist or psychologist, and pat you on the knee. Or before they do your exam, if they pat you on the knee, just relax. It'll be okay. Just relax. Well, we don't know what the bloody to relax.
Right.
You know, you can't tell us to relax. You want me to relax my earlobe? I can't do that. You want me to relax down there? I have no idea what's
No
next.
idea.
No idea. So be patient. That's all I can say. It takes a gazillion physicians and medical practitioners unless you hit on somebody really good the first time. So it's not just you. It's not just that what you're saying to your doctor was wrong or bad.
Right.
It's that they don't learn it. It's not, they don't have enough time to learn about all this stuff unless they have a specific interest in vulvar disease and in sexual function. So just be patient. There are avenues. You can find people.
Oh, that's amazing. And I love that because that's what we want people. Dee, hold the book up one more time. It's hold your book up.
The Pleasure Prescription.
The Pleasure Prescription. So people can find that on Amazon.
Amazon, A Surprising Approach to Healing Sexual Pain.
Oh, that's good.
And the first 2/3 of the book are all about looking at your anatomy, talking about pain, finding your sensuality and your sexuality, and then taking a look at the differences in vulvas, the difference in arousal states, and then really getting into your sexuality, all about yourself. It's all done solo, the first 2/3 of the book, because that's the key. We have to find ourselves. We can't expect our partners to give us an orgasm. Orgasms are ours, for God's sake.
Exactly.
They're ours to have. Right?
And I love that perspective of it. Like all of this really starts with us. And when we take responsibility and we take the time to explore, and I think a lot of women haven't taken the time to explore or experience themselves. So now you have this expectation of a partner to come in and just please you to the rockets, to the moon and back, and you don't even know what you like, you don't even know what you want, you don't even know your own body parts good enough to say, hey, no, touch here, don't touch there.
Right.
I like it here, don't do that.
So when it doesn't hurt, is it your failure or the partner's failure? That's hard to say, isn't it? Because but if we don't know, how are we supposed to bloody tell them what feels good if we don't know what feels good?
Exactly. And I love that. So you all make sure, because I want to respect Dee's time, but this is amazing. We'll definitely have to have another conversation so that we can dive in deeper. But you all get the book. It's on Amazon. This is what we're here for, to provide expertise, experiences, and resources. Because what I'm finding out, a lot of people don't know the resources. We have options, you all, and that is amazing. Dee, you said something with going to the doctor and everything, right? Let them know if that's uncomfortable. You have to use your voice and speak up. No one is a psychiatrist, right? No one is a psychic and gonna just, I think you want to do that. No, let me take all the guessing work out for you and just speak up. So ladies, use your voice. Take your own notes at home, right? I call it tracking and trending. Track and trend what's going on with your body. So when you go to the doctors or your therapist or whomever, you're able to have a conversation so that you can make the best decision with the options presented to you. So Dee, I just want to say thank you. Before we leave, let people know the best way that they can get in contact with you and connect.
The best way to get in touch with me is probably, this is a hard one to remember, D@VulvaLove.com.
Look, if you all missed that one, okay, D@VulvaLove.com.
VulVA.com. I'm on LinkedIn. I am, don't do the other social medias too well because it's just bloody too much time. You can find me on Facebook. I'm on Facebook, Dee Hartmann, Hartmann with 2 N's, HARTMANN. And I love this. And you go, girl. Man, I'm just, it's such an honor to be here, to be able to talk with you and see what you're doing. Bless your heart.
Thank you. Thank you. Same here. So you all look, you learned a little bit of anatomy. You learned some reasons that you need to be paying attention so that when you need to go to the doctor,
Yes.
and options that's out there for you. And so look, make sure you get the book right on Amazon, you all. It's right there. Get the resource, give it to someone else, right? And let's start teaching our younger generations now so that they can already know, look, this is the anatomy of my body and I love every inch, every crevice, every part of me. So no one can box in my sensuality. No one can box in who you are. So you all, until the next time, I am Carlika Katrina Basnight-Menendez, and we will talk with you again.